Hi, everyone. I'm Dr. Ryan, a veterinarian and a veterinary behavior residency graduate.
And I'm Dr. Serena. I am also a veterinarian and a veterinary behavior resident. So, our last conversation was about resource guarding, and we talked about Dobermans and whether there was a genetic link to that. And there was another comment on that video, and it was about what are your thoughts on neutering of a 3-year-old stranger danger, fearful American Bulldog that currently has no negative behaviors associated with being intact. So, what are your thoughts, Dr. Orion?
Yeah, so that's also a huge one, I would say. I think I even got into trouble for uh, for saying something in my clinic that was kind of different from what the other veterinarians that work there
I see.
are used to. Yeah, so I will tell it as a story, basically.
Yes, tell
Now,
us.
by the way,
Now
it's
I'm like,
yeah, like
give
to
me
make
the
it a
juicy
little more in
gossip.
depth. So basically, I just started working at that place. It's an older clinic, I would say. The owner, I think, is the owner for like the past 20, maybe 30 years, something like that. He's a great veterinarian, and he has really great clients. I really enjoy working there. But kind of like, I guess a student that just finished vet school might know more about some topics than I do, because although I do try to do continuous education as much as possible, I might not be exposed to all the professors and specialists that teach veterinary students. And me and you both have a lot of not just experience, but also that exposure to the behavior research that keeps coming out, like
Right.
specific topics or topics that we know that we're going to be asked a lot on, like exactly this question that we got in the comments.
Right.
So I've been working there for, I think, maybe a month. And to begin with, I told them, look, I'm going to give the recommendations according to what I believe in and what I know is true. Is if there's issues with what I'm saying and what you're saying, then of course we can discuss it and see what we can do. But I was actually asked by one of the clients that had a female dog, when should she spay her dog? And before I continue, so Dr. Serena, what I'm sure you also know, because that's probably something that you were also taught when you were in vet school. What did they used to say? Like, what was the best time to spay a female dog?
So, the best time, this is according to my school, we were taught by a board certified veterinary surgeon
Mhm.
that we should spay female dogs prior to their first heat.
Right. So that's what I would say probably 99% of veterinary students learn. Me too. And again, it's a specialist that said it. And all of it, or most of it, is actually based not on too many studies. It's
Yes.
true that they did see that spaying a dog before the first heat, so usually it's like before 6 months of age, they did see that it reduced the frequency or the chance of getting memory cancer by a lot. That's true. I'm not, as far as we know, I'm not saying that it's not true. But the thing is that nowadays we actually have other studies, and newer studies keep coming out, both regarding behavior and regarding health, that by spaying or neutering at an early age, we might actually increase the frequencies of other issues. So we talked about cancer, memory cancer in females, but if it's a golden retriever or maybe probably different other big breed dogs, then we might actually increase issues with other types of cancer or with joint issues.
Yeah.
So I was asked that question by the owners, and I said, yeah, I think you should wait for the first heat and then do it between the first and second heat. Then we still get most of the benefits, kind of like combating the memory cancer, but we also gain more time for the dog's body to develop, and body and brain, everything. Well, the brain is part of the body, but everything to kind of develop more, and hopefully to gain more of the benefits. And they of course kind of got upset, and by the way, I did tell the clients, it's important to know, I did tell the clients that even in our clinic you might hear different recommendations regarding it. So I
Yeah,
didn't lie, I didn't say no, this is the only truth, there are no other truths. I did say that
absolutely.
other doctors will say something different, and they actually did come back with a puppy sometime later, and the other veterinarian said, yeah, you should do it before 6 months. And they got kind of like confused and said,
Yeah.
but the other veterinarian said to wait until the first heat. So, of course, they kind of like called me and said, no, we need to be on the same page and blah, 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 blah.
Hmm.
Maybe even a little bit upset. And I said, don't worry, let's all be on the same page. And I sent them all a lot of scientific papers and reviews, and a lot of resources to show what I'm saying. So it kind of brings us back to the original question after all of this very long story. What would be the best age to spay or to neuter, and should we even do it? I mean, what would be the effect on the behavior? And there's definitely an effect on behavior.
Right.
So I don't know if you can read between the lines, you might already know my answer, but maybe you want to say what you think first, and then we'll see if we're also on the same
Yeah.
page or.
So we're on the same page when it comes to spaying the female. I still want to reduce their risk of mammary carcinoma, breast cancer, mammary tumors. So I do say, like, hey, we can let this dog have exposure to some estrogen, testosterone to get them to be closer to closing um, their growth plates
Mhm.
to help reduce their risk of, say, cruciate tear. But at the same time, if we wait until the second heat, that increases their risk with mammary carcinoma.
Right.
It ends up being a long discussion with the clients because if you work in shelter medicine, you're going to be sitting there, get them done as early as possible. And for instance, my puppy Cola, she was spayed at 9 weeks.
Wow.
And so 9 weeks is
That's really
really
early.
early.
9 weeks. Wow.
And the reason for that is that puppies are easier to adopt out.
Okay.
And they want to ensure that all of the rescues get spayed and neutered.
Oh, they
So
don't want to risk the owners not actually spaying later on and having more
exactly.
puppies coming to the shelter. So they say, let's just do it at 9 weeks and get it over with.
Exactly.
Mm,
But my fear is like, oh, what did that do to her growth plates?
right.
Does that mean that it increases her chance of a cruciate tear? And do you mind if I share this paper just because
Yeah, go ahead.
other people might want to see it?
Let's see if it lets
Let's
you.
see if it does.
Oh, yeah, yeah. I see that something is
So,
appearing here at to stage. Here we go.
so I don't know if you're familiar with this one, and maybe this is one of the ones that you
Yeah,
shared with
that's one of
your.
the those that I actually send them.
Yeah. So this is on 35 different breeds. There's another one. Oops. There's another one on mixed breeds, but it essentially talks about joint disorders, types of cancers, and urinary incontinence. And I have to say that I'm already seeing some evidence of urinary incontinence in Koala.
Oh.
So she kind of dribbles occasionally. I mean, it's
Hmm.
not horrible. It's not life-threatening. But when we talk about life-threatening diseases, so this here is talks about um, So it talks about lymphoma, hemangiosarcoma, mast cell tumors, and osteosarcoma.
Yeah.
And it might be increased in certain breeds. So
Mhm.
depending on the breed, so I
Yeah,
don't
it does
think
seem like
we.
bigger breeds are more prone to having those issues, if I remember correctly.
Yeah, so specifically to because the question was about American Bulldogs, they're
Yes.
not on this list. So unfortunately, we wouldn't be able to say specifically, like, hey, look at this, but
Yeah.
I'm just going to stop sharing this one for now.
Mhm.
I have to find where is
No.
it here? Are we back?
Yeah. Yeah. Yeah.
So that's the paper that I reviewed and looked at to say, hey, it's not so cut and dry.
Hmm.
So there's the aspect of behavior. Let's say, for instance, you have a line of dogs that genetically predisposed to being more aggressive. Let's just say that we have that. You are more likely to reduce aggression if you neuter them before they start to show signs of aggression.
So that brings us to I'm not sure if it was in this paper or if it was, well, actually, it was in several papers.
I don't think it's that paper
No,
about
okay. So, but
aggression, but another
there are
one's.
several papers. Sadly, I didn't come prepared. But
You could
I mean,
quickly look
I
it up.
can find it. If I'll have the time, I'm gonna link it in the description of this video so people can read one of them, or But even if you Google, let's say you go on Google Scholars or on PubMed, which are kind of like I guess the biggest search engines for scientific papers, and you search something like dog behavior and neutering or something like that, you should find most of these papers very easily. And more of these are coming out. Some of them, many of them are kind of like statistical studies. So they kind of like look at a very big population of dogs and all kinds of like different traits or breeds or are they spayed and neutered or they're intact, and and what kind of behavior problems they're showing. And we actually see that in many of these studies, the dogs that were neutered or were spayed were actually more likely to be aggressive or were more likely to have a noise phobia, if I remember correctly, and anxiety issues and all kinds of other behavioral problems where we see, statistically speaking, we see it more in those dogs that were neuter or spayed. And then comes the question, should we spay or neuter a dog that's not actually showing aggression? But you know what? Even if the dog is showing aggression, should we? Will it actually help?
Yeah.
And I would say that we still don't know enough to be, to be sure and say, yes, you should or shouldn't. But I
Mhm.
will say that because it's so unclear and because it sounds like it can go either way, it can actually make the dog worse than he was before, or
Mhm.
that she was before. Then you should think about it a lot before making the decision. There are countries in mostly in Europe that it's not that common to spay and neuter dogs. They don't have the problems that we have here in the United States, and as far as I know, in Canada as well. That they're like the shelters are sometimes full of dogs, and there's so many strays and dogs that were relinquished and they don't have a home, and that's why kind of like you explained, the shelter would wanna spay them at a very 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 early age to prevent it from ever happening.
Yeah.
But those countries that don't really spay and neuter because I guess they're just I don't know, the people there are better at keeping their spayed and intact dogs at home and not roaming and accidentally breeding with our dogs. We don't really see that they have more issues with aggression, and we don't see that they have less issues with aggression. So again, if I kind of like look at all of the information that we have right now, it doesn't seem like neutering and spaying would definitely reduce the behavior, like an aggressive behavior or any other behavioral problems. And we have some evidence that it in many cases might actually make it worse. So when people, and you said like going into a discussion about it and things like that with the owners in a shelter, it's kind of like might take a long time. Then yes, this is a very big one. And me personally, I used to recommend to everyone neuter and spay your dog like right away to prevent those problems. Nowadays, I don't. Nowadays, I
Yeah.
say like medical wise, it looks like we should probably do it between the first and the second heat in females, and probably after the dog, like a male dog, finished his uh, fully matured physically. So I don't know, around a year and a half, or
Yeah.
something like that. Behavior wise, it's even more complicated. And I say,
Yeah.
no, it can go both ways.
Yeah. So for this particular individual who has a male intact dog who's not showing any problem behaviors related to being intact. So problem behaviors for an intact male would be roaming, urine marking, excessive mounting, um, uh, uh, those kinds of problem behaviors related to being intact.
Right. And,
Uh,
and probably aggression around females that are intact. So it can be aggression to
potentially,
people
potentially, yeah,
or dogs. Yeah.
yeah. If they're not showing any behavior signs, there's still medical reasons to
Hmm.
neuter. I personally would wait, like you said, wait until they're fully grown. Their growth plates are closed. So, for instance, you're waiting 18 months for one of the giant breeds, 18 months to 2 years. So, this dog's 3 years. And from a medical perspective, there are benefits to castration. There are risks, of course. The difference between this particular individual and, say, one that's emotionally stable, so this one's fearful, has some stranger danger, is something called single event learning. You take a stranger danger, fearful dog, and you take it to the vet and it spends the entire day there. That is going to be more detrimental emotionally to that dog than leaving it intact.
Right. And many people will say this complaint that the dog was fine until they took him to the vet for surgery. Then his behavior changed. And
Yeah.
maybe his behavior didn't change because of the actual changes in hormones, because they don't happen that fast. They don't happen the day of the surgery. But because exactly like you mentioned, that this specific event, that single event, had that detrimental effect.
Yeah. So my recommendation for those ones, and we talked about it in the previous episode, is using pre-visit pharmaceuticals prior to them coming into the hospital for their spay and neuter. So I use both gabapentin and trazodone as a combination. You get a little bit of pain control with the gabapentin and a little bit of anxiolysis and sedative with the trazodone. And you can also reduce your gas anesthetic. If you
True.
use a pre-visit pharmaceutical prior to your surgery, and the gas anesthetic is the risky part. So if you can reduce your gas anesthetic by giving a pre-visit pharmaceutical, why wouldn't you?
Gabapentin to begin with is a crazy safe medication. That's why we had that discussion about the using this crazy high doses, like 200 milligrams per kilogram of a dog, and not the 20 or 30 that most veterinarians will use. So like 10 times more. So it has a very, very wide range, and people shouldn't be afraid to use it. And it's also used in dogs and cats with kidney and liver issues, and seems to be pretty safe for those situations. And as you said, it has the anti-pain properties, it has the anxiolytics. So why not? And trazodone is also very safe. So, a combination of these medications. I know that sometimes I would actually even use clonidine, but if we do use clonidine, then we need to remember that for the sedation, because many times we'll actually use Domitor, which is from the same family.
Yeah,
So
dexmedetomidine.
yes. So if I prescribed it, but they're going to go to somewhere else, prescribed as a behaviorist, but they're going to go to a different veterinarian for the surgery, which is usually the case because my behavior patients, I only do behavior. But I always tell them, tell your primary veterinarian what pre-appointment pharmaceuticals you're using.
Yes.
And people, like, if in general, if people want to learn, I'm also going to put a link for that down below, but the fearfreepets.com, it's a great, I think that's the one. Maybe they have one for like staff and one for the public, so I'll try and figure out which one is which, but they do have a lot of resources on basically making the appointment and the surgery and everything as fun as it possibly can.
As fun as it can.
Yeah.
I used to work at a practice where we did Serenia prior to as well. So Serenia or meropotent has some anti-inflammatory properties. And if you have a pet who gets car sick, maybe that's something, let's say, for instance, you're preparing to take your dog in for their spay or their neuter, and they get car sick, and here they go into the car. Now they're nauseous. Now they're at the vet, and now they're being poked and prodded, things stuck up their butt, and they're not going to be very happy with that. No. So if you do have a pet that gets car sick, having some meropotent prior to might be beneficial both for the car sickness, but also as an anti-inflammatory as well. So something to think about for our pet owners that are watching.
Yeah, no, that's great advice, because it's an anti-inflammatory. It's prescribed for or labeled for nausea for car sickness in the US, as far as I remember. Yeah, I think it's just basically for car sickness, but it's not only the car ride itself, right? I mean, they actually benefit from it when they're waking up from the sedation, because sometimes the anesthesia itself can cause them to wake up nauseous. So if we can get them to eat as soon as possible after the procedure, I mean, not as soon as possible when it's safe, but something like that, then again, they have a better experience. They don't wake up feeling sick to their gut. So yes, it's definitely a good idea.
So there's all sorts of things to prepare if you are taking your pet in for a spay or neuter procedure, not just from the fear aspect, but even just part of the medical procedure. I mean, if you're still using hydromorphone as your pre-med in your prior to your anesthesia, hydromorphone causes nausea as well. So that's another thing that can be beneficial for these pets as well.
Yeah, and we now even have studies of using mirtazapine, Mirataz, or any of those appetite stimulants as well after procedures to kind of try and get the patient to eat as soon as possible. So you can use it safely even with anti-anxiety medications, because we know that sometimes things like Prozac, like fluoxetine, and sadly some of the other medications as well, can actually cause some nausea as a side effect. And we want our patients to feel happy. We don't want to cause any negative effects. and then using something like anti-nausea medication or something to kind of like make them eat a little bit more and like be happy basically because they want to eat, then they eat. This is also kind of rewarding and they feel better. It helps with the entire treatment, and usually they don't need to continue getting those medications for the rest of their lives.
Yeah. Yeah.
It's important.
So post-operatively, because a lot of these dogs, when they go for their surgery, they are still bouncing as if they never had surgery the
Yeah,
next day.
yeah,
So sometimes I will prescribe gabapentin just for that. Some K dress. This
to
is
kind of like
Leo.
calm them down. Oh, hello.
She's come up from the basement.
And she's being a cat, showing us her butt.
Yeah.
Yeah, that's good. That's good. That shows that we're actually veterinarians that have pets, and it's just not like we know what we're saying. We're living it.
Yeah. I have a household with a puppy and um, two cats that don't get along. One cat has redirected aggression, so
Yeah.
we have lots to talk about.
Yeah. A lot of experiences to share.
Yeah. So I think that's probably it for this topic,
Yeah.
unless you
I
have
hope
anything
we
else to
didn't
add.
confuse people too much because we didn't have, at least medically, we do have an answer. Behaviorally, I mean, at least me personally, I said it's kind of like more complicated. I still recommend doing it, but people need to know the pros and cons. I want to be on TV.
Yeah, she wants to walk across the laptop. That's a
Of
typical
course.
cat thing.
Yeah. Awesome. So, like every time, let us know if you agree with us or you don't agree with us, or if you have more questions about this topic or any other topic that you would like us to discuss. I hope we did answer these questions that didn't confuse you too much, but it is a confusing question.
It is.
And yeah, I think that's it.
All right. Talk to you later.
Bye bye.
Bye.